Between the muscles, skin, and bone, there are layers of fibrous connective tissue called fascia. This fascial connective tissue is primarily made of collagen fibers and designed to stabilize and allow flexibility of tissues such as muscles, ligaments, skin, and other internal structures. In a healthy system, muscles are able to slide without restriction. However, following an injury, fibroblasts lay down more collagen and increase the fascial density, creating adhesions. Some people refer to this as scar tissue, which limits the function and range of motion of the muscles, joints, and other tissues in the region. Instrument-assisted soft tissue mobilization, or Iastm, can help loosen or release fascial adhesions through the use of special instruments and techniques. The beveled edges are able to specifically pull, stretch, and release fascial tissues. Iastm also promotes the movement of blood through capillary beds and stimulation of neurologic pathways and reflexes that affect muscle tone and mobility. Mechanical stimulation in conjunction with increased local blood flow and neurologic stimulation promotes optimal healing and function. Practitioners appreciate the use of Iastm for relatively short treatment times required and decreased wear and tear on their own bodies. The use of beveled instruments allows for deep, more specific treatments and adds another tool in the toolbox of any practitioner. Here we have a cadaver demonstration of some instrument-assisted techniques working on the superficial fascia. On the lower part of your screen, what you're looking at is actually the muscle. On the upper part of the screen, you're seeing the superficial fascia being reflected back. And if you look really closely at the junction between those two structures, you're able to visualize actually the superficial fascia and deep fascial connection right there. With various techniques and movements in different regions of the body, you're able to release different forms of scar tissue and adhesion that will improve overall function in this region.
So we're going to look at the ProStim 1 tool basic application. Generally what you want to do, you'll start with a scanning stroke to begin with, where you'll just work through and look for any areas of tightness or stiffness, or a little bit of fibrous adhesion maybe, or just roughness in the muscle itself. Okay? A couple of things to realize, biomechanically, this is an easy action for me to perform. Your strongest action is actually pulling in like this, so if I put my hands over top, using the using my fingers or even the upper part of the palm of the hand, you can hook in and get a very specific contact and slowly scan through and see if you notice any tightness that you want to work on as a light superficial scan to begin with, and then you can increase the pressure and start to drag through that tissue and lengthen out the fibers. Okay? There are different protocols that we can use that involve active range of motion, passive range of motion, and stretching, but just to see a basic fiber pull through right here. You can imagine, now this guy's about 200 pounds that we're working through right here. This requires a fair bit of force to work on somebody this size. How much this would actually save your hands. So you start off nice and quick, find your area that you want to scan through and maybe spend a little bit more time. Simply flip the instrument over, go from concave to convex edge, and you can actually give a little bit more specific pressure over top of that region. If you wanted even more than that, you could flip the instrument around. This edge goes from dull, dull, dull to a little bit sharper in this area, and you could start to dig in and get a very specific contact working on those knots or adhesions that you might find in that area as well. Okay? And if I wanted to get even more specific than that, I can use this instrument like it's my extra thumb, where I can push into it and I have a grip through my entire hand, and we could separate through the different tissues and start to sink in and just really work your way through it. Or maybe even doing it with a little bit of pinning and stretching, or if you were doing maybe more of a supraspinatus type issue, you could take the arm up like this a little bit, shorten supraspinatus, hook in, and then take him through a little bit of a lengthening action. Shorten, lengthening action. Taking that pressure, the contact pressure, is off of your thumb and onto a very specific edge that gives you specific treatment. When most patients say they want deep treatment, what they actually mean is they want specific treatment. Tissue-specific treatment results in better outcomes.